It's a common condition as we age. We're talking about cataracts, when the lens of the eye becomes opaque, resulting in blurred vision. The doctors at Charlotte Eye, Ear, Nose and Throat Associates can help clear up all your questions about it.
And they are the group to trust to treat cataracts.
We're here at Charlotte Eye, Ear, Nose and Throat Associates. Joining us now is Dr. Vipul Shah, talking all about cataracts. Thanks for inviting us into your office.
Thanks for having us. We appreciate you coming.
First off, what are cataracts?
So cataracts are the natural lens of your eye that starts to get cloudy over time. And so people oftentimes when they come in, they think that it's a film over your eye or something that's kind of hazed over, but really it's inside the eye. So I brought a little model for you guys to see. The eye has a lens just like a camera does, and over time it starts to get cloudy, kind of like this inside. And so when that happens, it starts to block the vision. And so what we do is we go in through tiny little incisions, pass through all this and get to the cataract and take it out. And then we replace it with an artificial lens that's been measured for the eye ahead of time.
So who gets cataracts?
So almost everybody will get some form of cataract at some point. There are some things that kind of are felt to accelerate cataract progression. So genetics plays a role as to when they kind of show up. Underlying diseases like diabetes. Some medicines can cause cataracts to form. Trauma to the eye can cause it. But in general, it happens to almost everyone at some point.
So is there anything we can do to prevent it?
So wearing sunglasses is helpful because it cuts down on UV light. That can slow things down. Obviously being healthy and maintaining blood sugars if you're a diabetic and that sort of thing, they're also helpful things. But some people are just going to get them.
At what point is surgery necessary?
So that's a discussion that people have with their physician when the time comes. There's kind of a spectrum as to when surgery is indicated. So we see the cataract and then it's really up to the patient and the doctor to decide, is it worth the risk of surgery? And that varies for people because some people have more sort of strict visual requirements throughout their day-to-day life than other people. And so we talk to them and figure out, what are your risks involved? What is the benefit for the surgery? And is this the right thing for you? And then we make that decision together.
And is the vision clearer once it's done?
Right. So that was our ultimate goal, is to remove that haziness caused by the cataract and restore their vision to something that helps them function in their day-to-day activities. There is the added benefit of that new lens that we put in. We're able to absorb some of the prescription that they used to have in glasses into that lens, which in most people reduces their need for glasses.
What can people expect during that kind of a surgery? What's the experience like?
So the surgery has evolved considerably over the past several years and has become really as sort of quick and painless as surgery can be. The procedure takes just a few minutes. People are awake during the surgery, but sedated a little bit, but aware of what's going on. They're really in and out very quickly, and almost every single person is surprised when it's actually over. There's typically very minimal restrictions afterwards, just some drops to take, and they're usually back and about doing what they want to do within a day or two.
So will a patient still need glasses after surgery?
Some do, and that depends on the patient and the type of lens they end up choosing. There are different lenses that we have available to us at different price points in some cases, and depending on that person's sort of visual needs and what their lifestyle needs are, we can talk to them about their options and what kind of glasses they may need or may not need depending on what they end up choosing.
So if someone is struggling, they have that cloudy vision, maybe time to come in and be seen by you.
Absolutely. They shouldn't wait. Don't torture yourself. Come and see us.
Thank you so much. Thank you.
Thanks for coming.
You know, Lena, after seeing that piece, Dr. Shaw seems so dang trustworthy.
He's great.
Wow.
He's the man, Dr. Vipul Shah. I like him so much. Yes, if I ever needed this procedure, I would go see him. To make an appointment, call Charlotte Eye, Ear, Nose and Throat Associates at 704-295-3000. Again, 704-295-3000. Or you can log on to their website. It's easy to remember, goodsenses.com, goodsenses.com.
And wear sunglasses, too. That's what I heard.
Isn't that helpful?
That's helpful,
To
yes.
prevent getting cataracts,
Yes.
wear sunglasses.
Yes,
don't leave the home without them, right? All right.